What did I?
Perfect.
Hey, fantastic. Now,
Yeah, I've been
make
trying
us,
to record. Yeah. Okay.
okay, good, Jacob. So it looks like we got it done. Okay,
Yeah.
good.
Good. I'm trying to find a place to park because I was driving on the freeway, so I'll be here in a couple seconds.
Fantastic. Well, you can start out, Dr. Neetu. So what a powerful group you have here. Amazing. All right. I'm just going to go make sure the other groups, but Dr. Neetu, can you speak and I can hear your voice?
Yeah. Can you?
Ah, fantastic. I can hear your beautiful voice. So I'm going to go make sure the other groups have everything they need, but enjoy your powerful session.
Thank you. Okay, so shall I start with now?
Yeah.
I think
Yes,
everyone
please.
is there, right? Yeah. So
If we are
when-
recording, we can start. Yeah.
I'm recording, Jacob.
Okay. Excellent.
yeah, so when I started, I joined Ayushakti in 1998. Okay, and when I joined, I was just newly, I have learned Ayurveda 5.5 years. And then I was not really sure that how much Ayurveda can help, you know. So when I joined with Pankaj Bhai, so on the day first, there were a lot of people coming from different places and waiting for him. And I said, oh, this many patients waiting, and people have come from Delhi and Bangalore and many different places. So I said, what it is like. And then I saw that there used to be, we have to write down the history. So what is the case study about it? Okay, so there was a lady who came and she had a big thyroid. So such a big thyroid. And she was told to get operated. So, and she was a very old lady. It was 75 or something. And doctor said, when we operate, it may happen that your voice may go, or you may have difficulty in swallowing. So this can happen. So she was not very that I don't want to go for operation. So she came to Pankaj to me, and he said, okay, I'm giving you some herbs and you have to meet regularly. So I was very curious. So I just, sonography was done, but I did it with the measuring tape, how big it is. Okay. And I used to watch her every 1 month when she used to come to visit Pankaj Bhai. So I used to check that measurement. And within 2 years, that slowly that gland started shrinking, thyroid gland. Okay. And that after 2 years, it was just like a peanut, so small. And then I came that yes, Ayurveda can really, you know, in this difficult case, if we can give result, so definitely Ayurveda can work. But everything should be in a proper way. All the 6 tools should be properly given. Home remedies, pulse checking, diet should be there, panchakarma. These are all things which should be done properly. Okay, so then it helps. Fine. You have any question? Any difficult case where you want to ask?
No, but Dr. Neetu, can I ask about this woman that you were seeing? So she had a large thyroid. So she had hyperthyroidism. So she had a goiter. So then what kind of herbs do you give for that?
So see,
I mean,
there-
how do we assess that? So for example, we know someone has hyperthyroidism, and then what's the next thing to think?
many things. Like first thing is, first you have to follow the diet. No wheat, no milk, those things. Okay. Along with that, uh, if it is like immunity has to get better. Fibroid, there is some herbs which helps to shrink the nodules if there is any nodules. Okay, and immunity has to be definitely taken care along with that. Okay, so there are multiple, and metabolism has to get better, because thyroid you have to work on. So the herbs which were given to her was Meta Boost, Fibrin, and Fibrin was in the high dose. Okay, so I learned from Pankaj Bhai that pulse, this, when there is a bigger problem, you have to give in a higher dose. Okay, and along with that, nothing, so no nourishing food for her. I think for a long period of time, no sugar, no wheat, no oily stuff. And in India, it is very difficult to follow that. So because people are more used to wheat,
Right.
but she followed and it gave her a result, very good result.
As
And
far
then I
as
had a faith on him that yes, Ayushakti can give results.
so if I'm thinking about that patient, does that mean her agni is high?
Her
Does
Agni,
it does uh-huh.
no, Manda Agni.
Mhm.
Its Agni is low.
Agni is
Digestive
low.
fire is less. So see, if there is your digestion is not proper, then only there will be any lump or any growth.
Okay. Okay, got it. Thank
And
you.
then only there will be thyroid. Thyroid is with two things, lot of stress, and along with that low metabolism.
Okay. Thank you.
And I had one more case, which I did it, and it was like I still remember her very well. Okay, so there was a lady who was even supported by 4 people, and they were bringing to clinic. I said, "Oh my God, she cannot walk. How they are coming here in Ayurveda?" Okay, so literally 4 people were holding her, and they were bringing her. Okay, and when she said, I saw her pulse, and I said a lot of vata, and along with that, a lot of other things were there, a lot of stress, anxiety things were there. And I said, okay, so she had a slip disc, and in that she had a severe pain where she was admitted in the hospital, and from the hospital they gave discharge that we cannot operate. You go and first control your sugar, because her blood sugar was more than 400. Okay, and they said that we cannot operate you because she was admitted for 10 days, and they said in this high blood sugar we cannot you do anything, whichever pathy you want to do, first control that, because 2 type of insulins were given, 3 types of tablets were given, but then her sugar was not coming down. So they said you do anything, bring the sugar in control, then we will go for operation. And we started with her treatments first day. Okay, because she was in so severe pain. See, when there is a pain, automatic, due to that stress also people get more high sugar, right? Fine. And her pain was very severe. She was unable to even sitting and having food was also difficult for her. That bad it was. And we started with the treatments, and slowly she felt better. And after a month, she started coming alone also for the treatments. So then I asked her, Papama, you don't want to go for operation? You can ask your doctor. Now your sugar is also coming in normal. She said, if I'm not getting pain, why should I go for operation then? You know, and in that many days, slowly, I told her to meet her diabetologist also, because it was very high sugar. Okay, so I told her that I'm not going to change your insulins or any tablets. I will give you treatments. You go to your doctor, whatever he is tapering down, and then only half a tablet was remaining in 1.5 months or 2 years. But only half a tablet. Insulins were first stopped, and then later on tablets were tapered. But they don't
Wow.
stop. Total sugar reports cannot be stopped, so they give only half tablet. But this happens like if we go properly, but there has to be total the 6 steps which I was talking about: diet, panchakarma, along with that home remedies, everything should be followed properly.
Dr. Neetu, when someone has pain, their blood sugar goes up?
Yeah, if you have more pain, see, sugar can be with two possibilities. If your pancreas is not proper, and second is a lot of stress, anger, anxiety.
Because of the cortisol? Okay.
If
Thank
there
you.
is a lot of stress, anxiety also, your sugar doesn't come in control.
Okay. Thank you.
And she was unable to sleep also, even with painkillers. You can imagine, she was admitted and she was given rest. So how severe pain would be. Any other you want to ask some questions?
Regarding these two cases, or just in general?
In general, whichever cases you want to discuss or you need any. Yeah.
I have a question regarding like diet. So I know like with the people that were like that, like for example, like my sister and like my mom, that they like visit with you regarding their diet. Like, do you tell them not to eat certain things, or do eat certain things, or like how does that go? Because when I was reading their email, I didn't see about like a diet aspect.
Because I have told them to go for a healthy meal detox, right? So the healthy meal detox has more mung and vegetables. So that is a prescribed diet for 28 days.
Wait, say one more time. I didn't hear you.
So I gave them healthy meal detox, right?
Well, when I was reading their email, right, on the email it says the herbs, and then the home remedy, and then we talked about the marmas, but then I didn't see about their like the diet. So I wasn't like, my mom was asking me a question, I was just like, I don't know, like I don't know what you should eat.
I'm gonna share with you, if I don't do it right away, just remind me. I got from Ayush Shakti also the diets for different conditions. It's like what things they can eat and what things they cannot eat, but you need to have the condition, the prescribed condition, in order for you to know which diet it is. But
So, see, when I give healthy meal detox, I don't give diet, because if I give diet and along with that I give healthy meal detox, people get confused and they eat this also, and healthy meal detox is not taken properly.
So
Okay.
I guess the problem is then I don't know what is healthy meal detox is. So I don't know
So
that.
I will send you a PDF. Okay, so it is a 21 days. 21 days you have to be on a mung beans and vegetables, and that is a remedy.
Okay.
Detoxifying your body.
Okay. Okay.
So that has to be there is a particular diet which you should follow.
Okay.
Okay, I will send you now, so you can see on that. So what is that diet?
Okay.
So that has to be followed for 20 days.
Okay. And that will be for the like all three people that you saw, or like how do you determine like which diet you're giving them?
Yeah, so I think I have given to all the three of them.
Okay. Okay.
So in the last paragraph, I have written healthy meal detox.
Okay. Okay. All right.
Okay.
Okay. Cool.
So I will
yeah,
send you.
and it's not for everybody, because she just saw one of my clients just before this meeting, and she told me, no, she cannot go into detox, because of her condition. So it's not for everybody. So yeah, it makes sense. It totally makes sense.
So when after 28 days, we can give her diet.
Okay.
So whatever particular, so if it is vata pitta, we can give that, or kapha, we can give that. But when we give both the things at a time, then people get really confused. What should be eaten and what should not be.
Okay. Perfect. Thank you.
Yeah,
Dr.
that's right.
Neetu, is it when we see, is it cases when they have too much that we give them the detox? Okay. And with who would not have too much like what is a scenario where you think the patient doesn't need it?
So when there is a condition like hemorrhoids,
Hemorrhoids.
colitis,
Uh-huh.
where there is a bleeding or something, the chances of bleeding or something.
Uh-huh.
Where heavy menstrual cycles are there and she gets really weak. So in such cases, it is better when she gets her better immunity and her hemoglobin is good, then we can go for detox.
Okay, thank you.
Or even if a person is really weak, his condition is not that good. Uh, Nervous systems or somewhere where it is very very weak, then we have to first focus on her immune system and then we have to work on that cases for detoxification. Yeah.
Dr. Neetu, gee, just a new case that a family member came this last week to my attention is a start of Parkinson's disease. Of course, this auntie has she had, when I saw her 2 years ago, I could see her hands, she's trying to do something, but never thought, but now it's progressed. And I think after her second vaccination, she couldn't really move her muscles. So if you can speak about that a little bit, I would appreciate that, Dr. Neetu.
Yeah, yeah. You see, Parkinson is extreme vata. Okay. In Ayurveda, it is said to be Kampa vata. If you read Charak and those things, it is Kampa vata. Okay. And in this we can give very good results, in fact. Okay. So when there is extreme vata, Shiropichu helps. So any oiling on the head helps. Okay. There are some herbs which gives nourishment to the nerves. Okay. There is Mahanarayan oil which helps reduce vata. Okay. And oiling is very important in Parkinson. Okay. But there should be no arm again. Okay. So little bit of moong and vegetables. First, you should, whenever you are doing oiling, ama should be reduced. Okay. So more moong and vegetable diet. You can have millets. Those things can be eaten. Okay. But no non-vegetarian food, alcohol, those things should be avoided. Fine. Then oiling and something for nourishing the nervous system. There are Suruday, brain toe, please. I had one case of Parkinson at present going on, and she's much better. She didn't even know that she has Parkinson. She came for back pain, and I said, "You have tremors." So she said, "No, I don't have." I said, "Your neurologist have told that you have Parkinson." She said, "Nothing, but I met some doctor. I will bring the paper next time." And I saw the paper there. It was written that it is Parkinson. Okay, but she was not knowing because she didn't focused on it. And I said, okay. And then we started with all this. I gave her all home remedies. Then first I taught her in the clinic, and then I gave all these home remedies at home, and she is much better. Now she can cook food. She can stand for a longer period of time. Now she is cooking for her daughter also. Before she was unable to do that. She used to keep maid for that. Okay. So Parkinson, we can give very good results. White pumpkin is very good. Any nervous system, if you want more nourishment for the nerves, white pumpkin is very good. It is Sattva Gun Vardha and it has more nourishing. So I had one patient from Germany where he had during the ski he got injured with the spinal cord, and whenever he used to sit, like he has totally damaged. He was on wheelchair, and only 25 years boy. Okay, and he had such a injury that whenever he was sitting, he used to dropped down like this. His spine was not keeping it straight. He used to bend like this, and then he used to get up like this. And every like in an hour, he used to get bent 3 times, 3-4 times. Okay, and then after detox and after busties, uh, with spinal dharas, there are some treatments which gives nourishment to those areas. And along with that, white pumpkin help. White pumpkin juice. Okay, so whenever this Parkinson or anything, white pumpkin juice helps.
Dr. Neetu, is that the same thing as the ash gourd?
Yes.
Ash, and is that you only have the juice of it, or you can cook it too?
So you can see either have juice, or you can have in a like in India they put it in sambar.
Uh-huh.
The
Along with
best.
that. Yeah. So you are South Indian?
No.
My whole friends are South Indian, Dr. Neetu.
So they know properly. Okay, and you can ask them, because if you don't get in your place, you can ask them where you will get white pumpkin. They can tell.
Exactly. It's by the season is a little bit difficult.
not
Dr. Neetu is not always available, but the gourd, the other one that is longer, so I don't know if that can be sometimes substitute or it doesn't. It's a longer pumpkin. Is it okay?
So it is not
It's not exactly ash gourd. Yeah, got you.
But it's bottle gourd, but that's fine. You can have it, use that, but that has a particular property of nourishing. Nourishing and sattva gun vardhak. So which helps both the places, especially in the nervous system. It helps.
Dr. Neetu, if it's frozen available, is it still okay or not? I know. I got you. Got
my expressions. You got it.
Okay. Oh, got you. Yeah, we'll find it.
Ayurveda always says that it should be fresh.
Fresh,
okay,
of course.
And if it is not, then you can use other forms also. But it's always good to have a fresh.
No, totally got it. Beautiful. Dr. Neetuji, if they have some like a fire in there and they're dry, what I ask is still water, or there is a little bit of pitta also high avail, is mixed water pitta. So eye problem, skin problem, and very dry. So I said apply the ghee underneath the feet and navel. Just wanted to ask, pitta is present or just high water? That's the problem.
So it is in Ayurveda. There is a quotation: pittam pangu kafam pangu pangavamal dhatvara. So that means that pitta, kapha, everything is limbless, cannot move by themselves. Okay, they have to be carried from one place to another. See, the real place is fire in the stomach, right? Pitta. Yes. But you get headaches, you get burning sensation in the eyes. So then that vata is carrying that pitta to some different places. Okay. So vata is also equally important, but we have to take care of both the things at that time. Okay. So pitta has to be taken care, because that is giving disturbance, but vata also has to be equally rectified. Okay, that has to bring down. If there is a lot of skin issues, eruptions, so then first give something to clean the bowel movement. So at least some toxins or some pitta is removed from the body, and that is why we get good results in skin problems. Okay, Ayurveda helps in skin problems because we try to remove toxins out from the body. It is not just suppressing.
Question.
Okay.
Yeah.
Go ahead, Moshe.
I was just gonna ask about ghee. So how does ghee help with pitta, vata, and kapha? Like it's like, so I've noticed that it's like people that have like all three of them, they get like to use ghee. So how does ghee help with, like, how does it
Ghee
work?
So ghee is more lubricating, right? So as I told you now that if there is extreme vata condition, oiling is important.
Okay.
Okay. So ghee helps in reducing vata. Okay. If you get burn, if you apply cow's ghee, you feel smoothing effect. So in heat also ghee helps because it has cooling effect.
Okay.
Okay, and there are ghee which is medicated, like in panchakarma we give ghee to drink. Okay, so there are these are medicated with the herbs in it. So if there is a skin problems, we give mahatikta growth. If there is digestion issues, we give pachak growth. If there is mental issues, we give medhya growth. Okay, so these are the herbs which are put in, and then the ghee is put.
If someone is like vegetarian or like vegan, that they don't eat ghee, what is,
Coconut oil.
huh?
Coconut oil
Coconut
or
oil?
Coconut oil.
olive oil, that are fine.
Okay. Thank you.
Okay, my question is a little bit different. I noticed that when we set up the appointments, you go right at the beginning of the appointment with a series of questions, what you call the pulse reading phase. Is there like a set of specific questions that there are the same questions all the time? I'm asking this because many of the clients that I'm going to start bringing in don't speak English very well. So I have to do the translation and the appointment is going to take longer. So I would love to have all that information ahead, and not just that, but translated, because sometimes there are terms that I don't know how to translate, because there are no terms that I use daily, you know.
Right.
So it will be very, very helpful for me to have like all the questions outlined. So when we get into the appointment, I can just give it to you, or I can even
That
send
is
it
good
before the
idea.
appointment.
Yeah, that is very good idea. Yeah, because yes, your clients are talking in some. So which language they are using?
Spanish.
Spanish. Okay. Okay. So that is good idea. I will give you some questionnaires, so you can beforehand you can ask those questions, and it will be ready. That will be good. Yeah.
Oh,
Yeah.
Dr. Neetu, may I also get that? Because that would be very helpful.
Yeah.
Yeah, I can share it with the group, or you can put it in the group, and then we all can take it from there. And also, it's gonna help us, you know, to learn how to start the appointments, you know, with clients. So
Thank you. Thank you for
yeah.
that, Jacob.
Sure. And in another question, I know the very basics of pulsing, right? The very, very basics. But since these are most of the people, these people that are, or they are already my clients, or I see them often, I would like to start checking their pulsing, you know, just to try to figure out the differences. That don't affect at all, right? And it's not like, because somewhere I read that they needed to be like 4 hours fast before I take the pulse, or
True.
something like that. Is it?
Yes, it is. It is because what happens is, now if you eat banana and you come and show me the pulse, I will feel more kapha. Okay, so I will be focusing on that there is something related with kapha, but it can be with the
Okay.
food.
Okay. And when you are doing this with doing the pulse reading through the questionnaire, that don't affect if
I
they
have
just eat?
see with the questionnaire, it's very rare that we do with questionnaire because we do with pulse more.
Okay.
Okay, so very less time we just ask questions and then the answers, but when we see the pulse picture is all clear. It is like a TV, so we understand everything, where the vata is, what they have eaten, what is their mental situation.
Okay. And lastly, also my understanding is that part of the of the treatment, or well, can help a lot as part of the treatment to do some yoga poses. I know that not all people are flexible and not all people do exercise. I totally get that. But there are some that they do, even they practice yoga.
That's
And
good.
well,
Yoga
so it is possible to have the exercises that they should avoid and the exercises that they can continue doing
in yoga, right?
in yoga, for the people that practice yoga.
Yes. But then we should know that which yoga they are doing. Okay. So if they have blood pressure or something, then they can go for Shitali pranayam. And so that we should know that whether they are doing, and they know all the names, because there are some people they do yoga, they do breathing exercise, but they don't know the name of which they are doing.
Yeah. Most of the people are in that situation, or they know the names, the American names, not the original names. But if it's possible to put in the recommendations or the exercises, so we can tell to those that, I mean, they're flexible, like my mom is, I cannot give her that, right? But for example, Adriana, we just have an appointment, she can do those exercises too.
Right. So yoga, definitely. See, yoga is as Ayurveda. Same thing is yoga. Yoga, if we practice, it is very good. Okay, that helps. So half of your medicines are stopped then when you do yoga. Okay, but I don't know in your place how much yoga they are practicing, and they are used to yoga. So everyone knows
Yeah,
that.
so there's people that do it, there's people that don't, it's I actually have yoga teachers that have health issues.
Yeah.
So
See, normal. I can just send you some yoga that is like Anulom Vilom, Kapalbhati, Brahmari Pranayam. Those are the things which is very good. So anyone can do that, and that is very simple breathing exercises. Okay. So they don't need any more flexibility, or so, like if your mother is there, so she can do. My mother does yoga every day. Okay. So that is breathing exercises. Okay, not poses, but breathing exercise definitely everyone can.
okay, very good, thank you. That's
I can
it
write
for me.
down some yoga which they can do, like the consultation which we had. So I can recommend her what she can have, but I don't know that names. If I have video, I can show you.
No, but that's fine, because I can look online. If you
That
give me
is
the
fine.
name, I can I can look online, and then I can figure out from there.
Right, fine.
Excellent.
I have another question. So if a person is Vata mainly, is it better for them than not do like exercises like running and things like that?
No, because Vata person will not sit much. They will always move. Okay. So Vata people, they will always move, but you have to give them more oiling on the head, and give more oil massages so that they don't get muscle pain and pain like. Because
And
Vata person will get pain.
When you say put the oil on the head, so they put the oil on the head like before they shower, and you just let it sit there for like how long?
So at night you can apply oil.
Okay. And then in a morning
in
shower?
Parkinson, there are 3-4 oils which you should mix, and you can apply on the head. Like you have to wear like a cap. That is Shiropichu.
Okay. And then in the morning you shower, right?
Yeah, in the morning you shower, at night you apply, so that it remains for 12 hours, at least 6-7 hours. And if you don't get time, you can just apply, and after 1 hour you can wash your hair.
Okay. And then a different question is like, so if you I'm about to actually call this person to like find out more details, but I just found out that my mom cousin, like, she's like losing her ability to walk. So like it started like I guess from her feet. So now she's like on wheelchair. And she's young. She's not that old. She's like in her like mid 60s. So she's like has an ability like she's now in wheelchair, but now she has to wear like diaper because she's unable to like control her like body movements, like bowel and urination and whatnot. So like what is like the so I want to have I'm gonna have a conversation with them and I want to get back with you, but is it best for them to just have the first visit with you and then like come to India? Like I'm trying to like have it like figure out like which was the best way to have a conversation with them. Is it best for them to come to India and actually do the panchakarma there, or is it best to
First send her all reports to me. Okay. Along with that, we will have a phone consultation. So what it is exactly?
okay, so have a conversation with her and then do a phone
Yeah,
consultation?
because she is losing the control. So there is a big muscle loss, right?
Yeah.
Right. So bring all the reports also, like MRI or whatever done. That has to be seen.
Okay. And do you want me to email you those ahead of time? It will be better.
Before that. Yeah, before the consultation, I need all the reports.
Okay. Perfect.
Dr. Neetu, I have a follow-up question on the neurological issues. So if, say, for example, children who have attention deficit disorder and not hyperactive, just focus, what kind of herbs or remedies do you initially start out with for those kinds of children?
So in this, we have to see both the things, like more vata or more pitta. Okay, that has to be also seen. Okay, and according to see, Ayurveda is not about that. If you have fever, you can give paracetamol.
Right.
Okay, it is about what is disturbed. More
Right.
pitta, more vata, what it is, and according to that, we select the herbs. Okay, so we have some herbs which we can recommend them. Okay, like mind power, bliss, sumeda, but which to select, that has to be seen. After seeing them, we can understand. So it is more vata or more pitta.
Okay, so then more vata would be the children with hyperactive movement.
Yeah, but even attention will not be there. Like if there is more vata. Okay, so we have to ask them particular questions, and then we have to confirm.
Okay.
Okay, so it is related with pitta or it is related with vata.
And then pitta would be children who are very, very focused.
More anger.
More anger. Okay. Yeah, I see. Okay. All right.
Okay, they're having more sweating. Okay, so there can be many reasons for that also.
Okay. All right. Thank you.
For them also, oiling helps. Huh?
Dr. Neetu, actually, the case is me. I had the COVID about 2 months ago, which lasted long, and the fever was about, I would say, 10 days. And the fever started from the stomach, and it was very dry, very, very heavy and very dry. And up until the end, it took like, I would say, a month and a half to 2 months. I could feel it that is lifting and then coming up and until leaving me. About 2-3 days, really, I could have only some sips of water just to keep the medicine down. Forget about immunity. I couldn't look at immunity. I couldn't look at turmeric. I couldn't keep it down. I tried, I couldn't. Then I was like, being a mother, when someone is sick, I run around, I try to have juice, I try to help, everything. nothing was, I couldn't even ask what I want. So for 3 days, not much, maybe some sips of water and some bites of apple. And then after that, I just remember that I asked my family for 7-Up. I said, give me 7-Up. That's what we use, ginger ale. Give me something like that. With that, I could start drinking something just to put my medicine down. Otherwise, I couldn't keep anything down. After 5 to 7 days, little bit of eating. Then after 12 days, my friend made rasam, a lot of rasam, which I just dove into. God bless her. And I started feeling better. That's the only thing I could eat for about 2 weeks. So, Dr. Neetu, it took a long time. Then I came to know I'm very, very severely dehydrated. The way that I couldn't think, I was so foggy. I was telling Jacob, I can't do my homework. I was telling Ralph, and Ralph was every day sending me stuff, but I couldn't even comprehend at that time. Me helping everybody else, I couldn't comprehend. Now, Dr. Neetu, after all of this, and mentally be back a little bit behind my work, I was behind my homeworks and everything. Now I'm like looking at my body, and the skin was shrunk. That my husband told me, oh, yeah, your skin, he didn't want to scare me, but I really looked scary. And right now I'm looking my muscles. I used to work out, and I look at it, is pretty bad. It's like some spot, the fat is gone, some spot. What should I do right now, G? I'm trying to, with coconut water, with many electrolyte, in the drinks, but it was pretty bad. So if you can help me, I would appreciate that.
Yes, coconut water definitely helps. You can continue with coconut water, but your appetite is Agni is fully up now. You can eat everything now.
Yes, yes.
Yeah. So more squash type of vegetables will help. Okay.
Okay.
More soupy and squash type of vegetables will help you a lot. But it should be warm. Whenever you are take something warm. Coconut water is very good. Apple juice is very good. Pomegranate juice will be also good. Okay, pomegranate. You can have. Did you started with Virophyte or Immuno or anything like that?
Yes, I started, and actually Ralph texted me, reminded me of all of that. He's here. Ralph is here.
Yeah, he's here.
He's such a
Ralph
help.
Brown, right?
Yes, Ralph Brown. And with pomegranate, all it was apple and pomegranate. But when I couldn't eat all those days, it was pomegranate. Thank God it was in season. But right now I'm like, oh my God, am I having my focus, this shrunk brain? Everything was everything was out. I just want to make sure that I get that elasticity back. I'm a little bit scared, to be honest with you. This last 2-3 days, I'm looking and I'm like, oh my God, how do I get back to what?
Coconut water is very good. You can continue with coconut water, pomegranate, apple juice, bananas also. No bananas. Lungs were affected. Lungs were affected.
No bananas. I got you. Yes, I don't want that, but no, I'm better now. I'm good. No, I had some coughs, but thank God it didn't. A lot of coughs, but it didn't bother me as much.
Even energy drink can help you. So I will send you energy drink.
Okay.
You
Okay.
know energy drink, almonds, dates, fig, walnuts.
Yes. Yes.
Can try with that. That will give you a very good energy. Start with that 2 times a week.
Okay. Thank you, Dr. Thank you so much.
And something for your digestion. If do you take Lipton or which herbs you are taking?
Lifton, yes, I do have that one. Yes. Dr. Stephen sent me some stuff that I'm taking right now, but Lifton is one of them. Yes.
Continue with that. So your digestive fire will get better, and once it is better, then automatically things will get better. But white pumpkin juice, oiling your body, this is very important. If you can oil it with sesame oil or coconut oil, it's fine.
Thank
Massage
you
your
so
body.
much.
I
I'm
need
the one
to
who
say
never
thank
needed.
you.
Thank
Oh, I'm
you.
sorry. Thank you,
Go
but I
ahead.
have to leave. I'm so sorry. Thank you, everyone. And hopefully we'll get together again soon. All right, bye.
Bye, Roxana.
Bye.
Thank you so much, Dr. Neetu. Thank
Yeah.
you.
Yeah.
Do you have any questions, Christina? You are muted. You're muted. We are not hearing you.
So I don't know how to get patients. I don't know who to ask. I don't know how to get patients. But hearing about ADD, I met a woman recently, and she has two sons that both have ADD, and one's more severe than the other. I could ask if she'd be interested.
I'll be your patient.
So my patient doesn't my patient need to be with me during the call?
So Arisha said that she can become your patient. So okay, you can do the consultation for her.
I'm happy to have you as a patient, but I will. I'll contact you and we can figure out your appointment time. But somebody was talking some children with ADD and ADD, it sounded like. So I think I might give her a call and see if she might be interested in making an appointment with her two children. So we'll see. I know that one of them is 10, and then I'm not sure how old the other one is. I think he's younger. But that's it's been very challenging for her.
So any other questions anyone is having?
Well, just to answer the question for Christina, yes, you have to be on the appointment because this is how we learn, but you don't have to be physically with them. It's you just join because they're actually very early for us. You know, the appointments is like 6:30, 7 a.m. and on a weekend. So but just join the link. You know, I just had an appointment today. And I skipped the second one by mistake, but have a couple appointments earlier today, and I was first on my home and then on my car.
Okay.
So.
Like, you know, like if we're supposed to be practicing the pulse taking, I'm not sure, you know, that obviously.
No, not yet.
No, okay. So right now it's just questioning. Okay. So Arshla, I will talk to you after our class.
For sure.
Anybody else? Be a patient.
For sure. You are cutting off.
If you have issues getting clients, I can always invite you when I have appointments, and you can join too. But that is not helping you, right? You need to be able to do this and to promote yourself and to do the things. So my suggestion will be start you as a client, set up an appointment for yourself. So through the work and the marmas, you can start overcoming that those feelings that are preventing you from seeing your potential. And then it's gonna be easier. And I can actually volunteer to help you with your clients to get them into the appointments because it's very easy. I mean, it's first of all, it's very inexpensive. Second, it's very transforming and very powerful. And what it really helps me at the beginning, before we went into the rooms and all that stuff, I was working with another doctor. And I show to my clients the email with all the information, the outline of everything that they needed to do. And so I told them, you know, this is not like instead of your doctor, this is doing something with your doctor that is going to help your doctor to get you well faster. And these are the things that are affecting your body, as you can see, and these are the things that you can start avoiding, so you work with your body, not against your body. And they understood it very well, because if you start throwing Ayurveda terms to people that don't have a clue about it, you're gonna lose them, right? But if you just tell them, like, ground that information and tell them what is important for them, and that is instead of, and then they start sending you people. They say, oh, can my husband do this? Can my wife do this? Can we do this for my mother? And you start grabbing more clients, you know? The challenge is that in the future, you're not gonna be able to raise the prices with them. So be aware of who you bring, you know, because it's gonna be very difficult to get clients to pay more for the same appointment. But anyway, it's just, you know, to give you ideas.
Okay. Thank you. Thank you, Jacob.
Also, you could start with your own family too. Mom,
There
dad,
we learn.
sisters.
See, that is
and
what, that we don't have to search for things. Things will, like when we started with the pulse, you know, when we go to a function also, people will, okay, please see my pulse and tell me what is going on. So it is not about that you need to search someone, but Ayurveda is something which will, people wants to get rid of their health issues naturally, you know.
But I
Chemicals.
don't even know how to start talking about it. Yeah,
This is my suggestion. You know, if you don't even know where to start, well, first of all, of course, go through the appointment, because that's gonna help you also to build up confidence, right? But the second thing is, do everything yourself, you know, and then people are gonna start noticing your changes and transformations, and people are gonna start asking you, you know, what is it that you're doing? Oh, I am on this program. I can hook you up with them. You know, I'm at this school, and we have a special pricing and so on and so forth. But you start with you, and then it's very easy, because they can see it. They can physically and emotionally see the difference in you. So everybody wants to feel better and to do things better, you know, for themselves, you know. So that will help you a lot. And meanwhile, like I said, I can invite you to my appointments, no problem at all with that.
okay. Thank you.
Sure.
Rightly said, Jacob. It's really true. When we, yeah, right.
Dr. Neetu.
Yeah. Yeah.
Sorry. Oh, you were saying something. Sorry. I'll let you
No, no,
finish.
you
I have a
tell.
question.
Yeah, you tell.
I have a question. So also, like, you know how Jacob was talking about someone that like doesn't speak English, and then you were going to ask them for like a set of questions. You know how like I had my like after like the first appointment, I was like, oh, it's good to maybe for them to write down all their symptoms. Is that also a good idea, so they don't have to like think about it? So then when they get on the call, they can tell you all the symptoms they're feeling, and then you can ask them questions from there as well.
Yeah, that can be also done. So they can write down what are the concerns they have. Okay, so that is also so they don't forget things. You know, sometimes we do the consultation and then sometimes they remember, oh, I also had this issue, so
Yeah.
I forgot that.
Yeah.
So if they can write, it's fine. That is good, in fact.
Okay, yeah, because that's what I did, had the after like my first first visit, like it was with my mom. I noticed, I was like, oh, like I should have had her to like look at certain things. Well, I kind of did, but she didn't write things down. But And then so when I had the other two people like write it down, it seems like it was easier for them. So they don't come back later exactly as you said. They're like, oh, well, I also feel this, and I'm like, well, I don't know what to do about that, you know. So, but so it's good to just like they can talk about all of those, and then is it a good idea to one thing that I noticed when you were asking questions from them? So is it a now good idea like after they write all this like this their symptoms down, and then they'll be like, okay, I want to work on this one, or this is the most important one for me to first to work on. Is that a good idea? So then they kind of like have an idea what they want to work on.
See, this is what the communication is. I ask always if you Jacob, what is your main concern?
Yeah.
You know, there are so many lists of symptoms and things like, okay, but what is your concern? What is your first concern? That I always ask. Then we work on it. Okay. So definitely it is the main thing which they should write it down, that what is your main concern, what they want.
Okay. Perfect.
And for your case, like you can check your mother's pulse also. So you will correlate with the symptoms. Do you know pulse reading? How to do that?
Not yet.
Not yet. Okay. So if you are taking, you have to, the person sitting opposite to you. So if you are
I know
doing it with
how
right
to do
hand,
Western pulse reading.
okay, okay. But just check Vata Pitta Kapha
Okay.
with your mother and with your sister. Okay. So if you are sitting opposite to her, from your right hand, you have to check her left hand.
Okay.
Okay. With hand like this. Okay. And so we have to locate the bone. Okay. So this is the bone here. Okay. Lower to the bone, there will be Vata, Pitta, and Kapha. Like
Vata, Pitta, and Kapha.
can you see? So you can see my hand?
Yes.
Yes. Okay. So this is Vata, Pitta, and Kapha.
Okay.
Okay.
Uh-huh.
Okay. Just you have to press that point and keep difference of only one tip of the pen. Okay. Difference between this 3 fingers, there should be a distance of 1 pen tip. Okay, very little difference. So like this.
I don't
Can you
see your
see my
hand
hand?
right now. Oh, I see your hand now.
This is better.
Yeah.
Okay, so this, okay. So it should not be stuck like this. All the 3 fingers should not be stuck like this. Very little space between the fingers.
Okay.
Space between the.
So kind of like this.
Yeah.
Okay.
But when you check yours, it should come like this.
And then you always check on the left one.
Yeah. So you have to check the opposite one. So if you are doing it with right hand, you have to check the left hand of the other person.
Okay.
Okay. And just press it, and you have the pressure will be, the Vata will be light, Pitta will be more pressure, and Kapha will be more pressure. So that pressure will be like this. You are not getting. So Vata you don't have to. Vata you don't have to press much.
Okay.
Pitta you have to press little, and Kapha you have to press more.
Okay.
You have to go deeper to find the pulse. Okay, just see Vata, Pitta, Kapha in your mother and in your sister's pulse.
Okay.
Okay, just write it down that much only. So then you will have a judgment.
Okay. Okay. Perfect. Yeah. I'll do
Yeah.
that.
Yeah. Wrong. Yeah. Then,
I got a question for you, Mel.
yeah. Good.
Doesn't each one of the doshas relate to an organ in the body when you do the pulse?
Yes, it is, but also which dosha is at which place. That is also equally important.
Okay, let's just say, for
So
instance, if you're doing Vata and you're doing it on the right wrist, wouldn't that correspond with the large intestine and the lungs?
I see. in simple way, vata, pitta, kapha. If you take a body from the chest till the head is kapha. Okay, from the abdomen till the navel is pitta, and lower to the navel is vata. Okay, this is the position of vata, pitta, kapha. Fine.
Yeah.
So, and in the same way, when there is vata, pitta, kapha, the panchakarma is also related with that. So, when there are pancha means five.
Right.
Okay, five karmas. Okay, so one is vaman, virechan, nasya, raktamokshan, and bastis. Okay, so vaman is to remove from kapha till here. If there is any block or anything which can be removed, kapha can be removed from the nearest places, mouth. Okay, so that is why vaman, it is vomiting. Okay, and when there is more pitta or toxins in the body, heat in the body. Okay, so for that to remove, the nearest place will be the anus. Okay, so we give detoxifying, that is a virechan.
That's the
Okay,
purging one, right?
yeah.
Yeah.
Nasya means nasa hi shirshodwaram. It is a door of the head. Okay, so if there is any sinuses, blocks, nasya helps. Okay, if there is a vata, so then from the lower we give bastis, enemas. It is a medicated enemas with oils in it, so which helps vata to get balance. Okay,
How often do you do leech therapy? Is that done very often, or is that a rarity to do leech therapy?
so how severe is your skin issues? On that we do leech therapy.
Okay, so it has to do with your skin if you're doing leech therapy, right?
Yeah, so if you have skin issues or if you have some other issues like a wound which is not getting healed or something like that, then leech therapy also can be done. Okay, raktamokshan can be with the leech also, with the syringe also, so anyway, but leech is also possible when there
So
is a
you have
skin
to have
problem.
special leeches for that. Are they
Yeah,
grown?
we have to bring that. Yeah, we have
They're
to bring
grown. They're grown in the laboratories, right?
that. Right. So these are the ways which the things are there in our body, and we can remove those toxins from this panchaka.
Yeah, because I made a mistake. We're doing nausea, and I made a mistake. I think I made the ghee too thick when I was putting it up my nose. So you have to make it a little more watery, right?
Liquidy. Yes.
Liquiding.
Yes. Yeah.
Liquiding. And
Because
along with that, nasya has to be whenever you do nasya. Your doctor has recommended you to do nasya, or
beg
you are
pardon?
doing.
I'm
So you're,
studying it, and we're studying all the five branches of Panchikama, but our instructor has us to experiment on ourselves with nausea this week. So I didn't dilute it enough.
I love that. See, nasya is also, we have to do it properly. Panchakarma or any karma, it's small things, but it has to be, the instructions which are given has to be followed in the same way. Okay, and if you go, Ayurveda is so deep. Really, if I tell you today also, I can learn many things. You know,
Yeah,
it is like,
because we had to do, we were told before you even put any type of, sesame oil or ghee up your nose, you had to massage this area with heat. With heat,
right, right.
if you're doing it yourself, you have to use like heated pads and so forth,
Yeah.
towels and so forth before you do it. It's like a pre-treatment,
Yes.
which goes with
Purva
all.
karma. It is said purva karma. Pre karmas. Yeah, purva karma. It is. Yeah, true. And then even diluting and even the time of the nasya is also important.
And it depends on if it's kapha or kapha or pitta, right?
Yeah. So kapha pitta, and even so if it is very cold, then not to do at evening times.
So you do one in the evening. I forgot which one it is. One you have to do in the evening, it's better to do in the evening. I think that's pitta, right?
Yeah, pitta you can do anytime, but for kapha, if it is nasya kapha, then you have to do it before sunset.
Yeah, yeah. You have to do it in the mornings, pretty much, before like 3 o'clock or something like that, right? Yeah.
Before
Okay.
sunsets and till 4 o'clock you can do. After that, no.
Yeah. All right.
Yeah.
Thank you.
So I think it is done now. We can leave the room then.
Yeah.
Yes.
Yes.
I think so.
Thank you.
Yes.
Thank you, doctor.
Thank you. Thank you very much. Yeah.
Thank you, Dr. Neetu.
Bye-bye.
Thank you. Thank you.
Hey, doctor, can you answer me on the Adriana's? I sent you through WhatsApp or
Thank you so
the
much.
type of diet that she needs, just to confirm that I have the right one. I send you everything in WhatsApp.
Okay. So today we did the consultation, that one, right?
Yeah, it's the first person.
Yeah. So I will send you tomorrow because it is
Okay.
now 9, 11, 15. Okay. So I will send you tomorrow after 12.
Okay. Okay.
Okay.
Thank you. Thank you.
Dr. Neetu.
Bye-bye.
Yeah. Bye.
Have a good night and thank you very much.
Good night. Good
Good
night.
night. Bye-bye.
Bye bye.
Bye.
Bye bye.